good day. So for today, I will be demonstrating providing tracheostomy care. For the goal, the patient exhibits a tracheostomy tube and site free from drainage, secretions, and skin irritation or breakdown. For the equipment, we need to check for the bedside table, towel, tracheostomy suction supplies, sterile tracheostomy care kit if available, or 2 sterile 4x4-inch gauge pads. Next, sterile cotton tipped applicators, sterile tracheostomy dressing, sterile basin, and small sterile brush, small brush, roll-off twill tape, tracheostomy ties or tracheostomy holder, scissors, pulse oximeter, stethoscope, clean gloves, mask, goggles or face shield, hydrogen peroxide, TNS or sterile water. And for the implementation, we need to bring necessary equipment to the bedside stand or overbed table, and we need to perform hand hygiene and put on PPE if indicated. We need to identify the patient, and we need to close curtains around bed and close the door to the room if possible. And we need to determine the need for tracheostomy care, and we need to explain what you are going to do and the reason to the patient. Next, we need to adjust bed to comfortable working position, usually elbow height of the caregiver, lower side rail closest to you. And if the patient is conscious, we need to place him or her in a semi-Fowler's position. And then next, we need to check for the lung sound. And next, we need to place the towel below the trachea side, covering the neck and the chest of the client. Next, we need to put on a face shield, goggles, or face mask. Next, we need to prepare the basins and the cleaning solution. We need to mix a sterile water or a PNSS and a hydrogen peroxide in one basin, 50 over 50. Be sure it will fill 0.5 inch. And the next, in the other basin, add another PNSS in another basin that will fill at least half inch. And we need to perform gloving. In cleaning the tracheostomy, we need to remove the oxygen source if one is present, stabilize the outer cannula and face plate of the tracheostomy with your non-dominant hand. Grasp the locking mechanism of inner cannula with your dominant hand and press the tabs and release lock. And we need to gently remove the inner cannula and place it and place it in a first basin with PNSS plus the hydrogen peroxide and let it submerge there for a few minutes. Simultaneously, we need to gently slide the tracheopad or the dressing downward and discard. And then next, we need to check for some exudates or drainage, skin breakdown or irritation or inflammation. Next, we need to clean the inner cannula of the trachea tube using the prepared PNSS plus the hydrogen peroxide and use brush to remove solidified or sticky mucus. And then next, we need to rinse using the second basin with PNSS only. And then next, we need to discard gloves and put another gloves if necessary. Then next, we need to dry the inner cannula using sterile gauge or pad. After that, we need to gently insert the tracheostomy tube and be sure it is locked properly. Next, we need to dip the cotton tip applicator or gauge sponge in a cup or basin with sterile saline and clean the stoma under the faceplate. And then next, we need to pat the skin gently with a dry 4 by 4 inch dressing. And then next, we need to slide commercially the prepared tracheostomy dressing or the pre-folded or non-cotton filled 4 by 4 inch dressing. Check the fit of the tracheostomy collar. You should be able to fit one finger between the neck and the collar. Check to make sure that the patient can flex neck comfortably. And the next we need to apply oxygen source if necessary. And the next we need to remove gloves and assist patient to a comfortable position. Raise the bed rail and place the bed in a lower position. And next we need to check again the lung sound. Next, we need to remove additional PPE if used, perform hand hygiene, and document. We need to reassess the patient respiratory status, including the respiratory rate, effort, oxygen saturation, and lung sounds.